I'd like to update the House on our work to beat this pandemic and to make sure that the world is prepared for the pandemics of the future. Tomorrow we mark 6 months since the world began vaccinating against Covid-19 in Coventry Hospital. And in that time, we have vaccinated over 40 million people here in the UK, and 2 billion doses have been delivered across the globe. As of today, 76% of UK adults have been vaccinated at least once, and 52% of adults have had 2 jabs. The pace of the vaccine rollout has been extraordinary. This Saturday alone, the team delivered over 675,000 jabs, and I'm delighted to be able to tell the House that from this week we will start offering vaccinations to people under 30, bringing us ever closer to the goal of offering a vaccine to all adults in the UK by the end of next month. From tomorrow morning, we will open up vaccination to people aged 25 to 29. Over the remainder of this week, the NHS will send texts to people in these age groups, and of course, GPs will be inviting people on their lists to come forward. I'm sure that we've all been cheered by the images that we've seen of so many eligible young people coming forward and lining up to get the jab, showing that the enthusiasm for the jab is not just the preserve of older generations. People of this country know what it takes to keep themselves and the people around them safe. The latest estimates indicate the vaccination programme has averted over 39,000 hospitalisations and over 13,000 deaths. So the vaccination brings us hope, and I'm sure the whole House will join me in thanking people for their perseverance and patience as they've waited for their turn. Mr. Speaker, for all this great progress, there is no room for complacency. The Delta variant, first identified in India, has made the race between the virus and this vaccination effort tighter. Although the size of the growth advantage of the Delta variant is unclear, the recent best scientific estimate is of an advantage of at least 40% over the previously dominant Alpha variant, the so-called Kent variant. The Delta variant now makes up the vast majority of all new infections in this country. Over the past week, we've seen case rates rise, particularly in the northwest of England. But we know also that our surge testing system can help hold this growth. In Bolton, case rates over the last fortnight have been falling, and we've expanded the approach taken in Bolton to other areas too, and we'll roll out to other areas as necessary. I also want to encourage everybody in those areas to get the tests on offer. No matter where you live, regular tests can help keep us all safe. And we know that the test, trace and isolate system has a vital role to play in keeping this all under control. Of course, the most important tool we have is that vaccination programme. We know that the vaccine is breaking the link between infections, hospitalisations and deaths, a link that was rock solid back in the autumn. Despite the rise in cases, hospitalisations have been broadly flat. The majority of people in hospital with COVID appear to be those who haven't had the vaccine at all. And I want to update the House on some new information that we have on this. As of the 3rd of June, our data show that of the 12,383 cases of the Delta variant, 464 went on to present at emergency care, and 126 people were admitted to hospital. Of these 126 people, 83 were unvaccinated, 28 had received 1 dose, and just 3 had received both doses of vaccine. We should all be reassured by this because it shows that those vaccinated groups who previously made up the vast majority of hospitalisations are now in the minority. So the jabs are working. We have to keep coming forward to get them, and that includes, vitally, that second jab, which we know gives better protection against the Delta variant. Mr. Speaker, the confidence in our jab comes from the fact they're working and the knowledge that they're the best way out of the pandemic. No one wants our freedoms to be restricted a single day longer than is necessary. I know the impact that these restrictions have on the things we love, on our businesses, on our mental health. It is still too early to make decisions on step 4. The roadmap has always been guided by the data, and as before, we need 4 weeks between steps to see the latest data and a further week to give notice of our decision. So we'll assess the data and announce the outcome a week today on the 14th of June. I know that these restrictions have not been easy, and with our vaccine programme moving at such pace, I'm confident that one day soon, freedom will return. To do this, we must stay vigilant, especially at this time when school children are returning to classrooms after the half-term break, and when we're seeing the highest rises in positive cases amongst secondary school-aged children. So with schools returning today, it is vital that every secondary school-aged child takes a test twice a week. This is to protect them, it's to help keep schools open, and to stop transmission. This is crucial to stop the spread and to protect the education of your peers. While the evidence shows that the impact of COVID on children is usually minimal, we also know there is higher transmissibility among children. So the message to all parents of secondary school-aged children is please get your child tested twice a week to help keep the pandemic under control and to help on the road to recovery. The House will also be aware that our independent medicines regulator, the MHRA, has conducted a review of the clinical trial data for the Pfizer-BioNTech jab. Having already concluded that the vaccine is safe and effective for people over the age of 16, they've also now concluded that the jab is safe and effective for children aged between 12 and 15 years old, with the benefits of vaccination clearly outweighing any risks. So I can confirm to the House that I have asked the JCVI, the committee that advises us on immunisations, to come forward with clinical advice on vaccinating 12 to 17-year-olds. And we'll listen to that clinical advice just as we have done throughout the pandemic. Mr. Speaker, people in this country know that vaccines are the way out, but this pandemic won't be over until it's over everywhere. This week, the Prime Minister will host G7 leaders in Cornwall, where he'll work to persuade our allies to join the UK in our historic commitment to vaccinate the whole world against Covid-19 by the end of 2022. The Oxford AstraZeneca vaccine has already proven to be a vital tool in this effort, with more than 500 million doses now released for supply around the world. And crucially, it is delivered at cost. In my view, this approach, providing vaccines at cost, is the best way to vaccinate the world. And I believe that developing a vaccine and allowing countries to manufacture it at cost is the greatest gift this nation could have given the world during this pandemic.